we can have the clerk call the roll, please.
Representative James.
Here.
Representative Magnifici.
Here.
Rep Snyder.
Here.
Rep Plummer.
Here.
Rep Petrick.
Here.
Rep Gundrum.
Here.
Rep Billings.
Here.
Rep Ortiz-Velez. Rep Shelton.
Here.
Thank you. Today we're holding an informational hearing to hear from a number of invited speakers regarding substance abuse treatment and pain management in the state of Wisconsin. First up, we will be hearing from representatives from Take a Stand Against Meth campaign from Chippewa County. If the invited guests could come up, please. So good to see you.
Is it okay to take this off when I speak?
Yes.
Okay,
Yep.
Perfect. Perfect. So we're going to come up in pairs because we have quite a few people that are going to speak to you. I'm Rose Beyer. I'm the Criminal Justice Service Director for Chippewa County. And in that role, I oversee our recovery court, which some of you may know as drug court. We call it recovery court. I oversee our front-end intervention, treatment, and diversion programs, our first-time offender program, basically anything diversion related. So we really appreciate the opportunity to come and speak with you. I'm not going to do a lot of talking today because I brought with me 6 people actually with lived experience that have went through our recovery court process or our front-end intervention treatment program and who can speak more to the heart of substance abuse issues than I can. So just wanted to give you a little bit of background. So I have those individuals with me and then our Director of Human Services and our county administrators. So we'll all take a little bit of time to speak with you today. Just a little background on the Take a Stand Against Meth campaign. Which is probably no news to you up in northern Wisconsin. Methamphetamine is raging. In about 2014, we noticed just a staggering increase in all across the board in the entire criminal justice system. Not only affecting the criminal justice issues, the law enforcement issues, but child support, the clerk of courts, every venue in the system. Just to give you a number, in 2014, children in out-of-home placement in Chippewa County, we had 12 kids in out-of-home placement due to specific issues with methamphetamine. In 2020, we had 185. So it just gives you an idea of those staggering numbers that we're dealing with. So the Take a Stand Against Meth campaign, we call it that, full well knowing it's not just meth, it's addiction. It's what we've really related it back to is adverse childhood experiences and ACEs. So we, as a county, the county administrator, what are we going to do about this issue? And we realized that we couldn't do it alone as a government. We can't do it alone. We needed our community. So what we tried to do with this campaign is recruit community volunteers from all organizations. And we formed 6 task force teams, thinking that if we represented the business, law enforcement, faith, education, health and wellness, and service organizations, that would pretty much cover the whole gambit of the community. So we started the campaign probably a few years ago, really hit the ball, hit the road running. We're really doing a great job, and then COVID hit. So before that, we were able to have about 5 or 6 community town hall meetings, and we were able to really have some sit-downs. We filmed a documentary, and we have a website, Take a Stand Against Meth, if any of you are interested. I didn't bring handouts because most of our stuff is on there for you. And so what we did is we took that feedback from the community, from those town hall meetings all around the county, and we tried to put it into action planning and put it into place, the things that we were hearing from our community members. One of the biggest things that we heard was just the lack, the challenges that people had when they did have substance abuse, and if they had been in recovery and they had really turned their lives around with criminal records, trying to find housing and jobs, getting the business community on board. So part of that campaign for us is really getting business and community involved and trying to form programs such as like job coaching and mentoring for people with mental health and substance abuse, similar to what we have with people with disabilities, other disabilities. The other things that we're trying to do with the campaign is we developed some curriculum through our CISA 10 for the school-age children, not just related to addiction, but starting at kindergarten related to methamphetamine and things like that. So the campaign has really gotten up and running again and taken off. And we rely on individuals that have been through the experience to help us with the campaign and community members. Right now, we have about 160 people signed up just as volunteers to do whatever we need them to do with the campaign. So I think I hit the parts that I'm going to hit. I'm going to this is Laurel, and I'll let her talk with you and just share a little bit about her experiences in diversion.
Hi everybody, I'm Laurel Lendl, and as she said, I am part of the diversion program, but I just want to start by saying thank you for taking the time to listen. Platforms and the people listening is very important to me. I'm going to start by sharing a little bit about my story, and then talk about my experience in the treatment and diversion program, and then talk about ways that I think we can kind of combat this pandemic on substance abuse. So I grew up in Eau Claire, had an amazing childhood. Life was great. I went to the University of Wisconsin-Eau Claire and got my undergrad in nursing. I graduated summa cum laude with additional nursing honors, and the reason that I bring that up is because I worked really hard for that degree. It was something that was really important to me to learn everything I could to help people, and then I became an alcoholic, and within a year and a half, I was in and out of the hospital in detox 30 times. That's not an exaggeration. I was that sick. And I had gotten some felony charges and ended up in jail, and then I was referred to the treatment and diversion program through Chippewa County. That's what she had referenced. And it was a program that gave me an opportunity to learn about myself through counseling and learning how to get a sponsor in AA meetings and other resources in the community that gave me the tools and the knowledge so I could save my life. It was a life or death experience for me. It wasn't, I was a little sick. I had ruined everything in my life. 2 jobs, I'm my child, I am a mother, and it was very empowering to have a team that was, interdisciplinary, really focused on individualizing that diversion program to help me succeed. It not only gave me the opportunity to save my life, I had my charges dismissed, so I'm no longer a felon. I don't even have misdemeanor charges. And I'm currently a doctorate student at the University of Wisconsin-Eau Claire. I'm going to be a nurse practitioner. And, it gave me that education. It gave me the opportunity to help other people with substance abuse issues or just anything in medicine. Now I went that way in my life instead of the route of being an alcoholic and continually being in the criminal justice system. So it was a complete opposite direction that I was able to go into, and I'm really thankful for the opportunity to get an education and to keep my RN license and just to help others. And that was really the most important thing to me, because education is really important. And I think the big thing for me, I did go to inpatient treatment for 30 days. And when I got out, it was really hard for me to go back to life. I didn't know how to live sober. I knew how to live drinking and then lying and apologizing to everybody. But now you actually had to show up and you had to function and you had to deal with life stress. So for me, having some sort of transition after that inpatient treatment, such as a sober living house, would have been really beneficial. I think for me to even just having more long-term, other than 30 days, that really gets you sober, you're thinking clearly, but you really haven't had time to deal with all those things that are causing you to drink or, really getting away from those temptations. So I would say transitional housing would have been, or transitional, housing and then just transitional care or longer care would have been really beneficial in my situation. Other than that, I just want to say thank you and have a wonderful day.
We'll have a couple more people, and then if you want to have questions at the end, or did you?
Well, since you're both up here, we do have questions.
You are the chairs.
Yeah, whatever you say.
I'm used to doing that.
Representative Plummer?
Thank you, Mr. Chair, and thank you for making the trip down here today. I think we all understand how important all of this is. I've been fairly involved with the Columbia County Treatment Court, and it's run by Judge Hepler, and he's got a tremendous team there, but they're struggling. to reach the success that they wanted. I'm wondering how you guys are doing up there, and what the key you think is to success with that program.
We're actually doing pretty well, I want to say, in Chippewa County. Tracking our success and recidivism rates, we have about a 75% success rate after about 3 years with people not recidivating. We are seeing a lot of relapsing. We're seeing people relapse. We have a great team as well in place in Chippewa County. In 2013, we had received a grant, and we went from about 5 people in what we called drug court at the time to 25. So that's about our participant. We actually, just in the last 2 years, incorporated what we call Hope House. It's a sober living house that I actually partnered with our housing authority to start, and it's for people in our program. I think that's helped significantly. I don't think any of these guys were at Hope House, but they actually, so our alumni group helps chair our Hope House, our sober living house. So Laurel and a couple of the other people you hear from today help us with that. So I think that helps the success. We have a lot of buy-in in Chippewa County community wide, and with our district attorney and our defense counsels with our recovery court. I do a lot. I go to every single law enforcement jurisdiction, whichever shift they want me to come to, 5 in the morning. You know, I do that twice a year because I think you need the buy-in community-wide from law enforcement. We have 2 drug task force officers actually that sit on our team because we need that buy-in, and we need them to see that recovery court can work. And we need them to see not people only at their worst, but what can happen in the outcomes. So we actually will have, task force officers saying, hey, this person really needs recovery court, which is, it takes a long time though, and it takes a lot of that community involvement and education and a lot of legwork. But I feel like the relapse rates, especially with COVID, we really struggled. We kept everything going last year, but we do see relapses. You're going to see relapses, and we accept people back no matter where they are. We encourage them to come back. If they've graduated, they're out of continuing care, we're always wanting them to stay involved in our alumni group and come back if they need help. So that's another thing that we try to do.
If I could, a real quick follow-up, Mr. Chair. Thank you. And you're going right down the path I hoped you would, because one of the things I thought was missing in our program in Columbia County was the people that are graduating. I would love for them to come back and work in peer support. Are you seeing that in Chippewa County?
Yes, I had actually just written so we have CCS, Comprehensive Community Services. I don't know if you're familiar with that, but it's an extra funding source that helps us pay for some peer support to come back. And we try to encourage our alumni. In fact, I was just talking to Tommy today about becoming a peer support specialist. So I had written a federal grant, hopefully, that we will get that will help us pay for more peer support and recovery coaching. I think it's extremely important for people to have that peer who's been through that situation that can help walk them. We also started a mentoring in our court program. So when people get out of graduation and continuing care, we have them mentor our phase 1 people to keep them involved, and that really helps too.
Great, thank you. Thank you, Mr. Chair.
I'm sorry, I keep forgetting to push a button. Representative Shelton.
Thank you, Mr. Chair. It's been a while. Thank you both for being here today. Laura, thank you for sharing your story. I think that storytelling is so important to rip away the false narratives around who this is impacted by and how people are impacted. And I think shining a light on that is a courageous thing. Thank you for coming and doing that. You mentioned something when you sat down, and you mentioned adverse childhood experiences, or ACEs. And I'm familiar with this term, but I'd love for you to share a little bit more about what those are and the connection to drug use and abuse. And the reason why I would like you to kind of go into that a little bit is, obviously we're here to talk about drug treatment, but obviously that prevention on the front end is another way that we can think comprehensively here at the legislature about how we prevent people from being part of the issue. So can you speak to that a little bit?
Sure. So ACEs, or adverse childhood experiences, are really those traumatic events that happen to individuals, not even individuals with substance abuse or mental health problems. They can be any type of trauma that you may have experienced, from living with an alcoholic to having an individual in your family in jail. These types of experiences that a child has. A typical child with a supportive family growing up in a supportive environment may learn to be more resilient and overcome some of these things. But somebody who's in an abusive or traumatic environment is going to have a higher ACE score. So there's a score that you have. What we see, we've actually started screening individuals in our programs for their ACEs, and I've done some studies in the jail, just some random interviews and samplings, and the high ACE scores correlate with substance abuse and mental health issues. So the earlier that we can catch those, and what we're also doing as part of the campaign is providing ACE training and resiliency training, for the schools, for the community, because the earlier we can catch that, then the better that we can help them overcome before they become, addicted or have some mental health or substance abuse issues. So.
Thank you. Representative Billings.
Thank you, Mr. Chair. And I'd like to publicly thank you for having this listening session and helping us hear this information from the people who are presenting today. I think this is really helpful. Laura, I also have to thank you for coming here and sharing your story. I helped set up our OWI treatment court in La Crosse, and every victory, every good story we hear is so heartening. And sometimes it's hard to share those stories. So thank you for being here. And is it Rose?
Yes.
Okay. It sounds like your program is really going well. And so when you get together with the Wisconsin Counties Associations, organizations like that, are you asked to present? Are counties sharing? I know in La Crosse we're doing the Alliance to Heal with Al Bliss from our health department. Yep. Are you all sharing with each other what's working well?
We are, and actually our front-end intervention treatment program, I've probably met with 15 different counties to share all of our information and our program information, our policy procedures. We've went to other counties. I'm also a part of the pretrial pilot with the state and the evidence-based decision-making initiative. So as part of that, we've worked with the Wisconsin Counties Association as well. And it's just getting better with the assistance of DOJ, with all of us being able to share what's going well in some of these pilot programs.
That's excellent.
Yeah.
Thank you. And how about northern counties? Are you able to share with northern counties or?
Yep. A lot of those, yes, a lot of those are the northern counties, and a lot of their problem is the lack of resources up in the northern area.
Yeah.
Yes.
Okay, and then I know this drug use and the pockets where it shows up is cyclical, and sometimes it pops up, cocaine in some parts of the state, meth in others, but it seems like I'm from western Wisconsin too. It felt like 14 years ago maybe we dodged a bullet. We were sure meth was coming up, and you saw what was going on in Iowa, and it felt like we kind of dodged a bullet, but it sounds like in your area it's just there with a vengeance. Do you, and maybe this is a question for someone else, but do you know what's caused that rise in your area?
We don't, or I guess I don't, and we're even seeing it in this last quarter, even with all the efforts we're putting in place, we're seeing it even, what we've attributed to is the location for us of where we are with the highways and the bypasses through the cities. We're seeing a lot come in that way.
From Minneapolis?
From Minneapolis, okay. Yep, into that area. We're seeing most of it brought in that way, is what my law enforcement officers are telling me. And I honestly don't know, other than that, what the cause is. I know a lot of stuff the heroin is starting to trickle up into our area as well.
All right, thank you for your testimony today.
Thank you.
Thank you, Rose and Laurel.
We'll let Steve and Ryan will come up.
So come on up, Steve and Ryan. You just make sure the green light's on in front of you, that red light's turned green. Thank you.
All right. Let me go first.
Sure.
Hi, I'm Steve Jacobs. I'm from the Chippewa County area as well. And I guess just to kind of run through my story really quick is I started using as a teenager. It went in through my 20s into my early 30s, and by then it was completely off the rails. And ended up catching a couple felony charges, and let's see how to say that. That's when I was able to be enrolled into a Chippewa County Recovery Court. I'd been to treatment a couple of times before that, and nothing really stuck. And So with this program, along with my other sentencing, I was able to get a better grasp on it, I guess, is because it's a long-term program. I was in it for 15 months, and that entailed, everyday call-ins for random UAs and weekly meetings with the recovery court team. And by the time I got out of it, I had laid down a solid foundation for myself, kind of learn how to support myself, live on my own, have a job, just stuff that normal people do, that using, you don't have any of that. And it was just the most beneficial thing ever. This was back in 2016, and I'm still clean and able to, do volunteer work with this program still. Rose brought up the Hope House. Ryan, Laurel, myself, and another member who's not here, we go in there once a week and have a weekly meeting with the members there, offer some sort of peer support and just to see what their struggles are, if they're overwhelmed with anything. We can kind of help them through it because chances are we've been through most of it before. And I think it helps because we don't have authority over them, so it might be a little bit easier talking to us and, kind of a more, I guess, easier atmosphere for them to talk to. But, yeah, I guess I will always advocate for the Chippewa County Recovery Court program. I think when you guys ask what makes it so strong, what came to my mind is the programs that they offer in that program, too. When I was in it, it was just they did MRT and a couple of, like a financial class, but I know since then it's grown a lot, and they offer a lot more programming, kind of accommodating to certain individuals and what their needs might be. And I guess that's all I really got. I'll pass it to Ryan.
Thanks for having me here. I'm Ryan Hemower. So I grew up, much like Laurel, pretty decent childhood. My parents did divorce when I was 11, so I kind of went my own direction, which was I was a loner growing up, and that's kind of where everything kind of, I don't want to say started, but I just kind of always did my own thing. I just started working very, very young. I started paper out when I was very young. Kids are going out and having fun at the mall on the weekends, and I was, just doing paper out, and I was fine with that. Except for later on in high school, I found out that when I had a bag of weed, everyone wanted to be my friend. So that's where my addiction had originally started. It had ended with meth, and the reason for that is the price. You can stay completely high for a week or two for very cheap. Compared to my favorite would be like a prescription pills, painkillers and stuff. But I would get for the same price, I would only get 6 hours. So towards the end there, that it was meth. But throughout all of that, it was everything. It was, everything from Benadryl that you can buy in the store to alcohol to heroin to painkillers, just kind of all of it. Anything so I didn't have to be in reality anymore. Like Steve had said, I do help with the Hope House. I do some volunteering at a local food pantry as well. For me, what really helped was, aside from the fact that I did really want to be clean, is the length of recovery court. I was actually admitted on the do not admit list to Ellie Phillips because they would get me in there for 3, 4, maybe 5 days, and then they'd kick you back out. And what do I know? To go use again right away, and so that just never had a very good effect. So I was put on the do not admit list, which I think was actually a good thing because I do not believe that their treatment program is long enough. I went to the Salvation Army ARC up in Minneapolis, and I was there for 6 months. My dad got really, really sick. Basically, he died, so I ended up moving back, and this is where my story is kind of cool. Is it was kind of like a little bridge. Like I'm on my way to get better, and then right before I could start to go down, I got accepted into recovery court. So after I came back from Salvation Army, I was clean for 6 months. It still wasn't. I still had not had a strong enough support group yet, or support group. So I got accepted into recovery court, and I'm not a felon, so my max was 6 months, which would have been 4.5 with good time. So I could have just went and did the 4.5 months jail. But I was tired of that lifestyle. It would have been way easier to go do that compared to 2 years of hard work, and that's what I decided to do. So by going back to recovery court, I started a job full time. I went back to school full time, and did everything that they required. And now today, I'm part of alumni committee. I got my degree in machine tool, and this is just the beginning. So 4 years ago, I'm homeless. Me and my girlfriend just bought a house. put a bunch of money down on it. We got 4 dogs, 2 kids. So overall, it's been great. But the main thing I do want to stress, and I think we talked about before, Chairman, is a mentor at a younger age, and the length of treatment. 30 days simply is not enough. 6 months is simply not enough. But I also did want it very bad, so I just wanted to stress that a little bit more, and that's all I had. So thank you, guys.
Well, thank you, Steve and Ryan, so much for coming in here, and I just love how you both participated through the programs, and now you're volunteering and giving back. And I'm sure are either one of you mentoring now, or can you do that? Can you help? Are you sponsors for anybody or helping people?
We both sponsor.
Yes, and certain 12-step programs. We are available to mentor in the Recovery Court program also.
Okay. And my philosophy is, and I shared this with you, is we cannot arrest our way out of this situation. And I think for those that want the help, the key word want, we should be able to try and get services available to them so that they don't have to become a criminal to receive any types of services. Because it sounds like both of you were through recovery court, so that means you were arrested for some violation or a crime. I think we need to look at that big picture and see what we can do better there.
Yes, absolutely. It just seems to really come down to long-term treatment options. Obviously, a 30-day program is pretty standard at treatment centers, but to have a transitional housing or something like that to get out of for a few months with some kind of counseling or program set up for these people too.
The Hope House, is that a long-term program?
It's up to, how long can they live there?
Up to a year.
Up to a year.
Okay. Any questions? Representative Plummer.
Yeah, I apologize for being so chatty today, but I'm very passionate about this. I want to thank you two gentlemen for coming in. This is so important for us to hear these firsthand stories of not only on your way down, but your way back up and your recovery and your willingness to help other people. I do want to caution you about using the word clean, because that insinuates you were dirty, which I don't agree with. I think you're sober now, right? But incredibly proud of you guys. I'm sorry, Rose, I know you're done testifying, but who funds this amazing program?
Well, do I need to come over?
We have the sergeant out. If you want to come up and just, you can use the mic.
Thank you, Mr. Chair, for allowing me to.
Absolutely, no problem.
So initially, the funding was through a grant, through a JAG grant, but then the county has been putting money in to help sustain the program. So now our recovery court is fully funded through the county levy.
Okay. No help from the state or federal?
Not for recovery. Well, we do have CCS, the Comprehensive Community Services. What I did is I was able to get my recovery court case manager certified for CCS, so we do get some funds returned through her case management and billable time that way, just a portion of them. Otherwise, it's all through county at this time.
Awesome. God bless you. You're doing incredible work.
Thank you.
Thank you. Thank you, Mr. Chair.
Now, Tommy?
Representative Billing. Oh, we have more questions.
Thank you for being here. As an observer of treatment court, as you're both telling your story, I had to stop myself because I kept wanting to, in treatment court, you applaud. When someone does well, they get an applause, darn it, and you should. But I'm wondering about Hope House. So that's a residential treatment center?
No, it's a house for individuals, especially who have really bad lifestyles, what their whole family uses. It's to help them get up off their feet. So it's kind of like a halfway house.
So tell me how it works. Sorry.
Rose, do you want to? You know the specifics.
So basically, Hope House is something that we started through my criminal justice services division. So I approached Housing Authority and asked them if they would partner with us to basically buy a property that we could have just for our participants, and then My treatment team, myself, oversee Hope House along with our alumni group. So basically, it's a 3-bedroom sober living house. It doesn't follow best practices as far as having a peer on site because it's only 3 beds. But the team actually oversees it, and then we pay rent to Housing Authority, who is the landlord for Hope House. We have very regular visits at Hope House. The alumni group oversees it, and they're really the first channel for individuals there. If they have issues or grievances, they'll come to the team if they need to. But right now, it is only for people that are in the FIT, the front-end intervention treatment, and the recovery court program.
So does a judge tell you you can go to Hope House, or who?
The treatment team does. So anybody who's interested or needing a sober living house puts a referral or an application in for the team, and then the team reviews that application and decides whether the person can go there or not. There's a very minimal rent fee right now. I did write that federal grant trying to get the whole rent paid so that I could have anybody be there without funding. But basically the minimal fee right now for an individual is $200 a month to be at Hope House, and everything is provided for them.
Is there a limit to the time they can stay at Hope House?
Right now, we have it up to about a year, but there really isn't. Most of the people, because there are rules and restrictions as far as visitors and things like that, want to get out as soon as they can. So the nice part is because we're renting from Housing Authority, then Housing Authority will work with those individuals sometimes to get a place with them or be a reference for them to try to find another place.
And do you have a type of situation like that for people with children, like say moms and kids? What happens in that situation?
Unfortunately, we do not, and we're in that situation right now where we would need that. So that's one of the things that we do lack. People that are even in our programs, we don't have a place for them through the recovery court or FIT.
Okay, thank you.
Representative Schultz.
Thank you, Mr. Chair. Just to follow up to the funding, and you've mentioned this a few times, the layering of public funds with maybe grants and other funding sources. I know in my district, which is essentially the city of Green Bay, there's been a long discussion of the difficulty of planning sort of long-term when you're not sure if the funds will be there, and how do you demonstrate sustainability, and also how difficult grant applications themselves can be, and that there are significant barriers to these types of programs. So can you talk about how, if you had a more sustainable source of funding, how that could sort of change the way you function and how you serve your community?
Oh, I think that would be phenomenal, because I'm always telling Randy I need more funding, my county administrator. I do all the grant writing and all the project reporting, and it's extremely nerve-wracking. You know, even with the TAD funds that have been there for years, you can always lose that every year. So this great FIT program that I have, the front-end intervention treatment, is completely funded by TAD dollars. I'm always asking the county administrator every year, we need to start sustaining the programs, even though the grants are there, can you give me anything? So, but if we had that money to sustain, then you could plan more long-term. You know, there's a lot of things that I would love to do in the county with reentry programming and transitional housing, and I can write grants all day long, you know, but it's the sustainability piece that keeps me from doing that. I don't want to keep starting these great programs and then not have them sustained. It's kind of the same with our pretrial services right now, which is doing wonderful. We're a pretrial pilot for the state. I'm catching a lot more people on that very front end when they're first getting in trouble and getting them into programs, but if that's a grant as well. So, you know, that's the worry of the sustainability piece. So right now, sustainability, I try to do everything I can with CCS, with any kind of billable Medicaid funding that we can do with our programs, and then I beg every year for more money in my budget.
I have one more quick about funding. So did you, when you got your TAD funding, did you have startup funding that came from the state, or was that all?
The TAD funding actually created I think it was in 2014 I applied for the TAD funding, and that helped create our front-end intervention treatment program. So my whole entire FIT program, most of it is TAD funded still from the state.
Okay.
Yes.
Good to see it's working.
I think it is. I think we've done great things in the little bit of time that our Criminal Justice Collaborating Council has been around.
So Rose, you might as well just stay there. And so the Hope House, that is a facility available for anybody that has maybe hit rock bottom, they're ready to go full circle, or is it through the courts? I guess I got confused on that.
It's through my recovery court program, so it's under my division, the Criminal Justice Service Division. We run it. It's for people that are in the program, so nobody that is not in the program could qualify for there. And it's basically for individuals that have no other sober place to go. Sometimes, like right now, we have a spot waiting for somebody who's in residential treatment who doesn't have a sober place to go when she gets out, so she's going to go to Hope House. So it's for that, just anybody, and we run across that a lot. I think last year we had 50-some referrals to our recovery court, and I want to say about 18 individuals didn't have a place to live or county residence or a place to call home, so we really couldn't serve them. So
Keep up the good work, but just stay there. Any other questions? Okay. Steve and Ryan, thank you so much. Good morning.
Morning. My name is Tommy Allen. I'm with the Stand Against Meth campaign in Chippewa County. I also volunteer in the Chippewa Valley and a number of other avenues wherever I'm useful, really. To start out, I'm a product of the criminal justice system before diversion programs. I didn't go through the diversion program. It wasn't an option for me. It wasn't even created when I went through. Had it been, my life probably would be a lot different right now. I see that I work with people that have gone through the program, and I see the benefits that it does today. In hindsight, I can look back at what happened with me when I went through the situations that I've gone through, and one of the things that it keeps you from becoming a criminal, from an addict to a criminal, and that wasn't there for me. Don't know if it would have made a difference. I hope it would have. My experience, and my activities have damaged, like I deal with my consequences from my active addiction today. I went through a AODA program to become a counselor, got all the way through the program, high scores, everything, and got to the very end and 4 credits from graduating and can't have an internship because of my criminal history. So I'm blocked. Ended my schooling, sitting with all my debt, and it's a debt issue as of right now. The programs that I see difference. I see the recovery court working in Chippewa County. I see it working in other counties, but Chippewa County, it just the way that the alumni rallies around the people that are in it, and the way it works just makes a big difference in the people that are part of it. I think the ability to be in the program longer treatments, I think it would be able to do a lot more and have a bigger impact within the community. I infected my community a lot throughout my history of using, and I try to live my life today to make a difference where I can in that matter, and that's what I got.
Hi, everybody. Thank you for having me here. My name is Nikki Walsh. I am a recovery court graduate. So Rose touched a little bit about the ACEs. My ACE score was extremely high. At the age of 10, I went through a major trauma, and it continued throughout part of my life. I grew up in an alcoholic family. Both parents still active alcoholics. My dad, not my dad, he passed away an active alcoholic. Sorry, I get a little nervous. By the age of 12, I was drinking every day, started dabbling in drugs. 14, I was running away. 16, I was kicked out of school. My life was like that until I think I got my first real charge when I was 30-something. And then I was in and out of jails. Jails got me sober, but didn't keep me sober. I went to treatment, but after treatment, I was kicked, not kicked to the curb, but you're sent out with nothing. No supports, nothing in place. I ended up relapsing. That's when I entered Chippewa County Treatment Court. I think what's different about the Chippewa County Treatment Court is it gives you hope and support. They helped me leave an abusive husband. They helped me get my children back. They helped me get a job. They helped me showed me how to live sober, because I didn't know how to do that. I was in my 20s before I realized people don't drink every day. I didn't know people didn't drink. I grew up at bars in an alcoholic family. So I think if you ask what's different about it, is that's the main pieces, is all the support, the resources, and just helping me figure out. When I entered treatment court, they had me do a bio. That was the first time in my entire life I ever talked about that trauma, the first time. So it helps you get to those traumas to help heal, because you can't get better without healing, and you can't heal without support. So I think that's all I got.
Okay. Tommy and Nikki, thank you so much for being here and sharing your stories. I love that you use those two words of hope and support, and how trauma affects us at a young age. And I think one of the key points that I received from meeting with you all earlier was how trauma-informed care could come into play here, as well as ACEs, because that seems to be the revolving theme here: ACEs, ACEs, ACEs. And I'm just, one of the things that I think, if we're going to potentially, if we're doing screening with 3 and 4-year-olds for 3 and 4K programs, that we start looking at, use that as part of an assessment tool, even at that young age, so that we can put them on our radar moving forward and be preventative, be proactive, instead of later on in life becoming reactive. And I think that's what's speaking loud and clear in my mind right now. I am proud of all of you. I think that it's so cool and awesome to be in a room with fellow recovery people. And, that's part of my story. I have over 22 years of sobriety myself. And I think that it echoes loudly. And Nikki, when you're sharing about your environment, your growing up environment, I went through the same stuff. And it's what we do in life when we finally, for me, I think for most of us, it's hitting that rock bottom. And then what do we do from there? So I look forward to seeing what the future holds for all of you. And Tommy, your education story, that strikes a chord in my heart, especially for you to go through all of that and nobody catching that beforehand, I think is a problem, because now the debt's on you and nobody else. So I don't know if the committee, anybody has questions within the committee. Okay. Thank you both.
Thanks.
And Now we have Tim and Randy. Thank you both for being here today and taking the time out to come to Madison.
Hey, thanks a lot for having us.
Yep.
This is a really complex situation that we're dealing with. Addiction is very complex. First thing I'd like to say is talk a little bit more about the ACEs before I start into mine. What we know is that 4 or more ACEs individuals are 38% more likely to be Medicaid recipients, more likely to be an IV drug user, and so forth. What gets skipped over a lot is that the physical health issues that accompany those individuals as well. Much more likely to be obese, diabetes, heart-related ailments. The one thing I've heard a lot of too is why is methamphetamine become the drug of choice a lot of times? This is the old whack-a-mole game. Remember when we made a lot of the ingredients to make meth illegal? What happened is that the cartels capitalized on that. They found a way to make it cheaper. They found a way to make it more pure. The research has shown too is that dopamine is the thing that affects all addiction. That's the part of the brain that really gets us. And what we know is cocaine, the dopamine dump is roughly 500% more. Methamphetamine is 1,100% more. So why do people use meth more? It's the buzz and it's cheaper. So, but I'd kind of like to talk about my story a little bit too here and some of the ideas I have. My name is Tim Easker and I'm the director of the Chippewa County Department of Human Services. I'm also a recovering addict. May 14th, 2002, I'm sitting in the federal building. I'm a United States probation officer working for the federal government. When I heard these 15 words, that'll change your life forever. Keep your hands where you can see them. You're under arrest for manufacturing THC. Life changed at that time. I came to a line in the road. I could choose recovery, or I could go back and just do what I was doing. Luckily, I chose recovery. But I was lucky. I was one of the fortunate ones who got a chance at a rich, full life. I wish that for every addict out there. However, as we say in the program, the fate of every untreated addict is jails, institutions, and death. It's a fatal and progressive disease. Well, I know that saving everyone is not possible. I do believe there are some things we can do to lead more folks to recovery and keep them there. After my arrest, my first job was milking for $10 an hour. I used that money to take my social worker exam test. And by that December, I was a treatment foster care worker working 18 hours a week, being so happy and just thrilled that I had a job and would have that chance again to give back while working the program. But the rest is history, and here I am. I'm now the director of the Human Services. Very blessed, very fortunate to have. I met a whole nother group of people that I'd have never met. I'd have been retired at 57. I had mandatory retirement. And I would have never met this group of people that I've met that are loving, caring, supportive. It's an amazing journey. But I'm also part of a group in Eau Claire that's led by our local DHS area administration team, Zach Todd. This is a multidisciplinary group on what we can do to help bring some relief to the methamphetamine epidemic in our area. We are not naive enough to think that if the meth problem goes away, that we'll not be facing the next drug. It's about addiction. And we know this is a brain disease. The brain essentially reacts the same way when exposed to the addictive substance. It doesn't matter if it's methamphetamine, heroin, pornography, gambling, shopping, what have you. Whatever you're addicted to, that's what's going to give you that dump. One of the things we looked at, and I think this committee could take a look at, is it's been touched on a little bit, is long-term sober living facilities. I think this can be one of the single biggest game changers for folks after leaving an inpatient facility. The problem is when a person leaves inpatient treatment, where do they go? It's 30 days. They often go right back to the environment in which they're using. The same friends, same families. And while folks may have received some tools to aid in their recovery journey, they simply have not had the time to allow their brains to heal and neurons to form those new and healthy pathways instead of the old. Neuroplasticity is a concept. It's a real thing. It's about reformulating those pathways, taking the old pathways that were wired something like this. You're under stress, you're in trouble, you go use. The new pathway is the same. You have stress, troubles, we all do. We all experience that. But then you go to some mindfulness strategies, you go to a meeting, you maybe call a sponsor. Your mind goes to a different path. Reaching out for support. Long-term sober living facilities allow time for the brain to heal from the ravages of drug use. This takes time, can be a critical juncture for individuals in early recovery. At this time, folks are experiencing what is known as anhedonia, which is simply the inability to feel anything. This will be an issue until dopamine stores are replenished in the brain. Having that safe place to focus on recovery is critical. The chance of relapse is great during the stage because relapse, or going back at least feeling something, the devil you know, is better than not feeling anything, the devil you don't know, even though it heals over time. It can take up to a year for these brains to come back. When you look at brain scans of individuals, it's amazing how it takes a while for that brain to start lighting up again. There are a few services or facilities which are privately funded. So Rose talks about the Hope House. We had the Recovery House in the Recovery and Wellness Consortium. I used to manage that division. So we took some of our placement dollars back in 1993 and we rent a 4-bedroom house from the Housing Authority. And these are for individuals, and we've learned how to try and manage it a little bit over the years. We've had some ups, some downs. But it's for individuals that are on a journey in recovery already. They've been through treatment. They're at risk of relapse if they go back to where they're living. This is not staffed. We check on individuals, every day. The individuals there don't manage their own medications. Many individuals have co-occurring disorders, mental health and substance use. So we have them on med passes and things like that. But we're using that money, portion of that money, I think it runs us $32,000 a year, which when you think about a placement for an individual in Winnebago, $1,350 a day is what it's running us right now. We had, in March alone, my budget for Winnebago was $330,000. We spent $140,000 of that on Winnebago. 84% of those placements to Winnebago were methamphetamine related. It's just not unique to us, Chippewa County. It's affecting a lot. I've heard about Sawyer County. I had a reporter call me from there. And little Sawyer County is talking about being $3 million over budget on their IMDs. This is real money. This is having a real effect on other services in the county. Because we have to pay our bills. We can't turn off our phones for crisis. We can't turn it off for child protective services. We went from having 45 kids in foster care in 2015 to 2018 having over 200 kids in foster care. Again, 80% plus related to methamphetamine. This is affecting everybody. But going back to that long-term sober living, we talked about comprehensive community services. Could this be something that could be a part of the service array for CCS? I love it as an administrator. Everything is fully funded. Workers' time, all the services are paid for. It's an amazing program that Governor Walker started for us in 2014, where it would be fully funded if you were part of a consortium. So could that be something that could be a part of that package when somebody gets out of, and I love the SUD, the Medicaid benefit now for individuals with substance use disorder, that is paid for, but we need something else. We've heard them talk about that. We need a place for individuals to go, like the ARC in Minnesota, phenomenal program. We've had probably 2 of some of our most complex individuals that attain sobriety there. But that's over because it's a long-term facility. We need people to be in those kinds of clean environments. The other thing I'd like to talk about too is harm reduction strategies. That it's kind of sometimes hard for people in this country to stomach because it seems like we're enabling, when in fact we're not talking about enabling, we're talking about saving lives. And I like you talking about the language that you were using about clean and dirty. That's a part of it. It's a relatively new concept in this country when it comes to substance use disorders. This is simply a set of practical public health strategies designed to reduce the negative consequences of drug use and promote healthy individuals and communities. Some of the key principles are promoting public health interventions that minimize the harmful effects of drugs. Understand drug use as a complex, multifaceted issue that encompasses behaviors from severe abuse to total abstinence. Meet people where they are at in the course of their drug use. Maybe someone is not ready to completely cease their use of drugs. And I'm going to talk about Ryan. He talked about it this morning. I remember him coming to our office for years where I keep telling him, keep coming back. I'm still using. This is kind of weird. Why do you keep telling me? Because it's like going to church. We don't want to go to church because we're perfect. We're going there because we need help. And that's what we're talking about, is creating those relationships with those individuals, reducing that stigma associated with use, with both mental health and substance use, so that when people are ready to come, they're not ostracized. They're not labeled as the dregs of society. You know, and I look at that language, and I've seen that in some of our recovery team meetings at work. It's like somebody coming through crisis. Well, they're just a druggie. They don't have any mental health issues. And that happens. It creeps in slowly, and it's like, hey, well, time out. We got to start thinking differently about individuals. I know sometimes you end up with compassion fatigue, but we need to treat individuals as, because these are our mothers, fathers, sisters, brothers, uncles. These are people we love. These are citizens in the community. And it's ensuring that people who use drugs have a real voice in the creation of programs. Affirm people who use as the primary agents of change, and empower communities to share information and support each other. Harm reduction does not attempt to minimize the real dangers associated with legal and illegal drug use and how those issues impact our lives. Harm reduction in practice is non-judgmental, non-coercive provisions of services that have low-threshold program models and as a resource to people. The goal of harm reduction, for example, this would be clean needle syringe access to prevent the transmission of HIV and hepatitis C. We're seeing that if we talk to our public health folks, hepatitis C is going through the roof right now. So just because there's Narcan and just because there's clean needle exchanges, I don't think anybody here at the table is going to go, you know what, heroin sounds like maybe a good option this weekend. It's not going to cause people to use more drugs. It's going to save lives and maybe get them to the point where they're clean enough and at a point where they actually want to become sober. And I still use the term clean because we say that in meetings, and I know I got to change some of my language as well. Reduce mortality through the fatal overdose prevention and training in naloxone distribution, as well as linking to medical care and human services. Allowing for the possession of fentanyl test strips. And I just heard about this yesterday from an individual at the state. Apparently, these test strips are something that a user can use before they actually use the substance, the drug, to test for fentanyl. Because what we've seen is the mortality from opiates is rising at a level. It's a fairly steady trajectory. Fentanyl deaths have spiked. So the person gets the chance to test those strips to see. But what I understand is that they're considered paraphernalia at this point and therefore illegal to have. Is there something that we can do legislator-wise to save lives? That's what these are some of those things. Treatment for drug dependence via MAT, buprenorphine, methadone, naltrexone, and Suboxone. And I saw in your latest, talking about the facility or your latest newsletter in Eau Claire. And even in meetings, they're still that age-old. Well, are they really clean if they're using? We got to get over that. These are harm reduction strategies that we really need to look at. Finally, empower communities and reduce stigma. Community organizing and engagement. An example of this would be our Take a Stand program that we're doing in Chippewa County. And finally, I'm going to touch on research demonstrates that language we use regarding drug use can affect our attitudes towards people who use. So in a letter dated January 9th, 2017 from the Executive Office of the President, Office of the National Drug Control Policy, Michael Botticelli, the subject line is terminology regarding substance use and substance use disorders. And it started off with substance use disorder, the most severe form of which is referred to as addiction, is a chronic brain disorder from which people can and do recover. Nonetheless, sometimes the terminology used in the discussion of substance use can suggest that problematic uses of substances and substance use disorders are the result of a personal failing, that people choose this disorder or they lack the willpower or character to control their substance use. However, research shows addictive substances can lead to dramatic changes in brain function and reduce a person's ability to control his or her substance use, and that repeated use of these substances powerfully alters the brain chemistry and the function of brain circuitry to create a neurobiological disorder. And this last paragraph is what I wanted folks to really hear, is that research has also shown that people with substance use disorders are viewed more negatively than people with physical or psychiatric disabilities. Research found that even highly trained substance use disorder and mental health clinicians were significantly more likely to assign blame and believe that an individual should be subjected to more punitive sentences rather than therapeutic measures when the subject of a case vignette was referred to as a substance abuser rather than a person with a substance use disorder. In a public perception study, the term abuse was found to have a high association with negative judgments and punishment. Negative attitudes among health professionals have found to adversely affect quality of care and subsequent treatment outcomes. Shame and concerns about social, economic, and legal consequences of disclosing a substance use disorder may deter help seeking among those with substance use disorders and their families. And I remember the first meeting I ever attended, it was called We Do Recover. I'd just like to say we do recover. So, thanks a lot for your time.
Thanks. My name is Randy Schultz. I'm the administrator for Chippewa County since February of 2018. Before that, previous 7 years before that, I was the administrative coordinator in Lincoln County. So I've seen meth in a couple different areas in the state. In Lincoln County, it really was about cooking. When the legislation changed and you weren't able to cook meth, I thought meth went away. This is fantastic. We're not seeing a whole lot of it in Lincoln County at that time. I came to Chippewa County and was honestly shocked. I had no idea how bad the meth problem was. First thing we did is I was probably only there maybe a month. We met with several department heads, talked about how can we, because I got to do the budget, right? And the budget was coming up, so we have to balance a lot of different areas that we have to spend money in. There's a lot of areas that need the funds. So I think there were 7 or 8 different department heads together and asked, where do we need to put our money? And if you know anything about anything, people do not like to give up money in any department in order to fund another department. Well, they all work together, and I think that's one of the reasons things work so well in Chippewa County. We really have outstanding people. Rose, obviously, you can tell is a rock star. Tim is a rock star. The people that are sharing, I've seen them do this. I've seen them share in large groups in the community. I can't imagine how difficult that is. That's where they live. Everybody knows all their dirty laundry, but it really has a big impact. So we met as a team. They decided where that money should go, and we did that. We put some staff in DHS that we're really trying to get to the front end of the problem, and because I think prevention really prevents the larger cost, right? So my thing is that's where we started the focus. We started the meth campaign and for the same reason. Rose, as she's talked about, you really do need sustainability. One of the things you asked about. People need to know that these programs are going to continue to be there for planning. Rose has a lot of ideas, and we have put money aside each year for her program. This year we're going to be able to we have a contract with Lutheran Social Services that it looks like we're going to be able to bring that person on full-time as a county employee. And we've done that, and I think that's really important because people need to know that that's going to be there. But you do need buy-in from everybody. You need buy-in from the county board, which we have. You need the buy-in from the sheriff. The amount of programs in the jail was amazing to me when I got here. So we were able to, but that's only happens because the sheriff is on board with that. So you really need that community buy-in. Even with everything we're doing, we burnt through $1.2 million in the last 3 years of fund balance in DHS. Those mostly are going to out-of-home placements, but as you heard, the reasons for them, 80-some% of them are because of addiction, meth, in particular in our county. So any programs we can do, they're experts. They've lived through this stuff. I can give a little brief story on my personal side. My parents were alcoholics 45 years ago and stopped. I was 7 years old. I kind of still went down that lifestyle for a while till I was about 22, and I stopped drinking too. But seeing the generational changes that happened from them, for me and my brother, I was the first person in our family to graduate from college. I would not be in the position I am today if they didn't make that decision 45 years ago. I'm convinced of that. So it can really make a change. Another thing that happened to me when I first got to Chippewa County, I might have been there a week, and I was at a DHS meeting, and they did a video on recovery court, and they had some of the stories in there about the recovery and how they got their kids back. And I think I was there maybe 4 or 5 days, and I'm in the back of this room crying. I mean, I'm the new guy on the block, right? I'm this administrator. It's supposed to be, do my job, and I'm just like, this is unbelievable. So the generation changes that can happen from the prevention and the early thing is just the stories, the personal stories are what get me. So obviously we're all on board with this, but again, resources are limited, so we have to, look at every aspect of our county, but this is obviously a high priority in Chippewa County. I think that's one of the reasons it works.
Well, Tim, Randy, Rose, I just, I'm proud of what you all are doing to help those that are seeking recovery and help, hope, and support. For these people and individuals that are truly suffering. And that's what it comes down to. The mindset of one in recovery is, for me, it's train the brain. You have to retrain your brain. And I just applaud the efforts and everything that you're doing to be proactive in addressing what's going on in Chippewa County. Do you guys have crisis stabilization beds within your county?
We contract with Aurora for the region, and there are 4 beds there, and I think 2 are continuously occupied by the MCO, who utilizes them. So we really have 2 crisis stabilization beds in the area.
Are them used often?
When they're open and we have the right person,
because that has to be staffed.
We'd like to be able to, that is staffed. It's not medical, but it is staffed 24/7. We could at times use more. There's no doubt about that.
Do you have any, if grants and funding comes forth, any future prospects on another Hope House or bigger? I know it always comes down to money.
I think it does come down to money. Actually, Tommy and I were talking about that on the way down, and the alumni group and him personally were talking about how if we could do something with that, if we got grant money to start some type of a peer-run transitional housing, that would be wonderful. So we're always brainstorming about that.
And Chair, I think that's a key is what you just said. We listen to them because they know what works. So we're trying to put our resources where it's going to have the biggest impact, and they're the ones that know that. So having you guys listening to them and us listening to them, I think is the big key.
Great, thank you all. Rep. Schultz?
Thank you, Mr. Chair. It's Tim.
Yes.
Tim and Randy, Thank you both for being here. I have just a few questions and a couple reflection comments on what you shared. I love how you both highlighted that impact of coordination, that there's so many different people and leaders and different departments and agencies and stakeholders that need to be involved. And Tim, you mentioned public health, and that was something I was thinking about too, because there was just this report that came out by DHS in March that said we're 46th in the country in per capita spending in public health. And my background is in public health. Mm-hmm. And when you think about that from an investment perspective up front, from prevention, education, community, coordination of agencies, I think that's something we should be highlighting as what I think we could be doing better from a state. But also too, health education. I was a health education teacher for years. And I think it's important for us to remember and renew our commitment to that comprehensive approach of health education. There are learning outcomes and standards related to substance abuse, drugs, and alcohol for our public schools. And I think that's a great place to look as well, because we go where the kids go, and that's where they are, and we can reach them there. But I do have a question, and I don't know if this is for either of you or Rose, if this is for you, but in my community, I hear a lot from our BIPOC community that there are just not enough Black counselors and AODA counselors with the LGBTQ community or for undocumented folks. That to everything you shared here, that connection to someone that understands your story, there is a universal truth to what you've all shared. But we do know that those in the Black and brown community, LGBT, they have compounding factors. So can you speak maybe a little bit about what you have seen within those community members and ways that we could address those deeper needs with some of these marginalized communities.
To be honest, Chippewa is primarily a Caucasian community. We have very little. I can think of one individual who's African American,
Okay.
to be honest, since 2013 when I managed a Recovery and Wellness Consortium that came through our area. So yeah, it's not that individuals
Yeah.
don't have those substance use issues, absolutely. But yeah, you're right. And we don't provide the services, we contract with private entities for the drug treatment facilities and all these other areas. I think Milkweed is a resource in Menominee that tries to hire more diverse clientele. They do peer support. And I think they also have the Pure Run Respite in Menominee, that's also a crisis home. I almost forgot about that one. It's probably not for those on the level of at Aurora, but it's a Pure Run Respite home for those in crisis. But right, there's a lot of work that needs to be done in that area. Absolutely. And I think I hear from a lot of our providers, they're working in that area. Just finding people to fill jobs right now is really hard.
Mr. Chair, if I could just make a request, I think as we explore this topic more, I would love to, if there is a need, if the folks here today aren't able to explore that question, that might be something that we could do moving forward to hear from those communities if there's other specific needs or stories that they have too. And thank you very much for being here and sharing everything that you've done.
Representative Billings?
Thank you, Mr. Chair. Thank you for being here. And when I see the men in the suits, we talk money, right? So what we found is that, really this work saves money. It saves lives, also saves money, so it's a win-win. I especially appreciated the discussion on harm reduction. Actually, our chair and I were talking about fentanyl strips at the beginning of this meeting. I hope you don't mind I share that.
Absolutely.
So thank you for reinforcing our feeling that we need to do work on this. And actually, my colleague who usually sits here, she came in as a new legislator saying, I want to do something about this. I want to do something with fentanyl strips. We're talking about funding issues. That's always a challenge. But I think there is some energy toward that. And I think that will absolutely save lives. And thank you for also talking about the work with Narcan and needle exchanges. We know we save money with needle exchanges. I have a sis, we have discussions about it. She's not excited about that program either. I know people have differing feelings on that, but again, saves lives and it saves us a lot of money. So I think you're just spot on, and it's been such a positive morning to hear the work you're doing. Thank you.
And if I could just touch on the money-saving value of comprehensive community services, we just put together a slide. We had 6 children that was in CCS, and we looked at that some event, they ended up in placement. But we were looking at the amount of money that we saved prior to them, preventing them of going into placement. It was over $1 million that we had saved in placement costs. And placement costs is not Medicaid funded. You can't pay for those costs. Those are state and local funding that pays for all of those placements.
And we'll be presenting that to our county board. They need to see the results, because when I came on board, I added quite a few positions, and they need to see why we did that and that it's working, even though the demand never seems to be ending. But if we didn't have that, it would even be a greater cost. So we're going to present that to our county board next month.
Well, thank you both for being here in the entire Take a Stand Against Meth campaign. I like that marketing strategy, because taking a stand against meth, it's not just about meth, it's about all substance use disorder, but meth is the key hot topic item in our neck of the woods. And there is a bill drafted currently for fentanyl strips and decriminalizing them. So it's a work in progress. So I will echo what Representative Billings said. Representative Ortiz Velez introduced that, and we're working to hopefully get that pushed through.
Thank you so much. I just want to put one plug in for the Take a Stand Against Meth campaign. If you visit the website, we actually filmed a documentary, and Tommy has a documentary on there sharing his entire story, and we did that in partnership with WQOW. So both of the pieces of our documentaries are on there. They're interesting if you get some time.
Awesome. Thank you all, and I appreciate you making the trip down here today. Good seeing you all.
Thank you for your work and your time.
Thank you.